Did you say Lyme disease is a highly likely militarily engineered bioweapon?
I probably did say that.
Did you say that?
And that's what the developer of
I
Lyme
want all of
disease
our
said.
colleagues to hear it, Mr. Kennedy. I want them to hear it. You said yes. Did you say that exposure to pesticides causes children to become transgender?
No, I never said that.
Okay, I have the record that I'll give to the chairman, and he can make his judgment about what you said. Did you write in your book, and it's undeniable, that African AIDS is an entirely different disease from Western AIDS? Yes or no, Mr. Kennedy?
I'm not sure if I made that.
Okay, I'll give it to the chairman, Mr. Kennedy. And my final question, did you say on a podcast, and I quote, "I wouldn't leave abortion to the states. My belief is we should leave it to the woman. We shouldn't have the government involved, even if it's full term." Did you say that, Mr. Kennedy?
Senator, I believe that every abortion is a tragedy.
Did you say it, Mr. Kennedy? This
believe
matters. It doesn't matter what you come here and say that isn't true, that's not reflective of what you really believe, that you haven't said over decade after decade after decade, because unlike other jobs we're confirming around this place, this is a job where it is life and death for the kids that I used to work for in the Denver public schools, and for families all over this country that are suffering from living in the richest country of the world that can't deliver basic health care and basic mental health care to them. It's too important for the games that you're playing, Mr. Kennedy.
Appropriated by Congress for the purpose of vaccination programs. That is not what happened. You've done the opposite. You canceled $12 billion in grants to the states, including my state, that are used to administer and track vaccines. You promised Chairman Cassidy.
When did I do that?
Madam Chair, would you allow me to finish my question?
Keep going with your question.
When did I do that?
Let me finish my question.
Accusation. Just tell me when I did it so I can understand what the question is.
You have canceled $12 billion in public health grants to states, whether you know this or not. That funding is used by the states in part to be able to administer and dispense information about vaccines. Mr. Secretary, let me give you the full panoply of
accusations,
the things you said before this committee that didn't turn out to be true. You also promised Chairman Cassidy that the FDA would not change vaccine standards from, quote, historical norms. But what happened as soon as you were sworn in? You announced new standards for vaccine approvals that you proudly referred to in your own press release as a radical departure from current practice. And experts say that that departure will delay approvals. You also said, specific to the measles vaccine, that you support the measles vaccine. But you have consistently been undermining the measles vaccine. You told the public that the vaccine wanes very quickly. You went on the Dr. Phil show and said that the measles vaccine was never fully tested for safety. You said there's fetal debris in the measles vaccine. And this morning—
All true.
This morning in front of—
Do you want me to lie to the public?
That's not— none of that is—
Of course it's true. Of course it's true, Senator. Senator, begging your progress, you do not know what you're talking about.
For the record—
Let's have a little bit of order so that you can get
Madam
your
Chair,
question
I'm
and we
speaking.
can get
I didn't
this
ask. I didn't ask for a response yet.
I
I'd
understand
like
that.
to lay out the predicate of my question before I'm interrupted by the witness. He should
Go
have some
ahead.
respect for this committee.
Go ahead.
Just this morning in front of the House of Representatives, you also said that you, in fact, would not recommend that kids get vaccinated for measles. You said you would just lay out the pros and cons. Okay, so this is the summation of everything that you have said to compromise people's faith in the measles vaccine in particular is contrary to what you said before this committee. You said you support the measles vaccine, but then you have laid out a set of facts that are contested, and I will submit information for the record from experts who contest what you have said about the vaccine, and the result is to undermine faith in the vaccine. It's kind of like saying, listen, I think you should swim in that lake, but, you know, the lake is probably toxic, and there's probably a ton of snakes and alligators in that lake, but I think you should swim in it. No.
I'm asking you yes or no, Mr. Kennedy. Did you say that COVID-19 was a genetically engineered bioweapon that targets black and white people, but spared Ashkenazi Jews and Chinese people?
I didn't say it was deliberately targeted. I just quoted an NIH-funded and NIH published study.
Did you say that it targets black and white people but spared Ashkenazi Jews?
I quoted a study, Your Honor. I quoted an NIH study that showed that
I'll take that as a
certain
yes.
races
I have
are
to move on,
disproportionately-
I have to move on. Did you say that Lyme disease is highly likely a materially engineered bioweapon? I made sure I put in the highly likely. Did you say Lyme disease is a highly likely militarily engineered bioweapon?
I probably did say that.
Did you say that?
And that's what the developer of
I
Lyme
want all of
disease
our
said.
colleagues to hear it, Mr. Kennedy. I want them to hear it. You said yes. Did you say that exposure to pesticides causes children to become transgender?
No, I never said that.
Okay, I have the record that I'll give to the chairman, and he can make his judgment about what you said. Did you write in your book, and it's undeniable, that African AIDS is an entirely different disease from Western AIDS? Yes or no, Mr. Kennedy?
I'm not sure if I made that.
Okay, I'll give it to the chairman, Mr. Kennedy. And my final question, did you say on a podcast, and I quote, "I wouldn't leave abortion, to the states. My belief is we should leave it to the woman. We shouldn't have the government involved, even if it's full term." Did you say that, Mr. Kennedy?
Senator, I believe that every abortion is a tragedy.
Did you say it, Mr. Kennedy? This
believe-
matters. It doesn't matter what you come here and say that isn't true, that's not reflective of what you really believe, that you haven't said over decade after decade after decade, because unlike other jobs we're confirming around this place, this is a job where it is life and death for the kids that I used to work for in the Denver public schools and for families all over this country that are suffering from living in the richest country of the world that can't deliver basic health care and basic mental health care to them. It's too important for the games that you're playing, Mr. Kennedy.
During yesterday's hearing, you really showed a lack of knowledge about Medicare and Medicaid. So what is Medicare Part A?
Medicare Part A pays mainly for primary care or physicians, and then
No,
Medicare
so it is about, Medicare Part A is seniors coverage for inpatient hospital care. What's Medicare Part B?
for physicians and doctors. Medicare Part D
That is coverage for outpatient care and home health. So what is Medicare Part C?
Medicare Part C is a program where it's the full menu of all the services A, B, C, and D for Medicare.
It is Medicare Advantage, which it's the private insurance option for seniors on Medicare. So, Mr. Kennedy, you want us to confirm you to be in charge of Medicare, but it appears that you don't know the basics of this program. So let's turn to
explained the
Medicaid.
basics.
No, I had to correct you on several things.
Oh, you
Let's
just
turn
added
to Medicaid.
information,
Yesterday,
Senator. You didn't
said
correct me. I didn't get it wrong.
Mr. Kennedy, my time is limited.
Kennedy, whose decision was it to withhold child care and development block grant funding?
Senator, I want to point out that in 2021, at the beginning of his administration, President Biden submitted his budget on May. You know what? You made an accusation of me. I'm going to answer it.
Okay, I appreciate
On May
that.
28th, he submitted his budget. So our budget. We're a new administration.
Okay, you can.
And I also want to point
I
out.
have just 2 minutes left. I asked you a specific.
I want to
question.
point out something, Senator. You presided here, I think, for 32 years. You presided over the destruction of the health of the American people.
Well,
Our people are now the
Mr.
sickest people in the
Secretary,
world.
seriously.
Because you have
Mr.
not done your
Secretary,
job.
seriously. That is an
What have you
amazing
done about it? What have you
Mr.
done about the
Secretary,
epidemic
I am here
of
to
chronic
ask-
disease?
Mr. Secretary,
What have
are
you done
here
about the epidemic
What's this
of
dude
chronic
done?
Secretary,
disease?
seriously, Madam
Secretary,
Chairman.
I would ask you to hold back and let the senator ask the questions.
Mr. Secretary, I'm asking you a question about child care. I'm asking you who made the decision to withhold child care and development block grant funding.
That was made by my department.
Is funding for Alzheimer's disease research centers DEI
because you're holding up $65 million for 14 of those centers in 9 states, including the University of Wisconsin-Madison. Is funding for cancer centers DEI, because you're holding up $47 million in cancer center support grants at 9 cancer centers in 8 states? Is funding for rare disease research DEI, because you're holding up $55 million for 11 rare disease clinical research network grants in 8 states? These are just a few examples, and the list goes on and on, Secretary Kennedy. I've run out of time. I yield back.
And I quote, "We should not be giving Black people the same vaccine schedule that's given to whites because their immune system is better than ours." Can you please explain what you meant?
There's a series of studies, I think most of them by Poland, that show that to particular antigens that Blacks have a much stronger reaction. There's differences in reaction to different products by different races.
So I have 17 seconds left. Let me just ask you then. So what different vaccine schedule would you say I should have received? What different vaccine schedule should I have received?
I mean, the Poland article suggests that Blacks need fewer antigens.
Historically, there have been beliefs and, unfortunately, biases within the medical community that Black people are less susceptible to pain than white people. This misconception has roots in the era of slavery and has contributed to the medical exploitation and mistreatment of Black individuals, as well as ongoing racial disparities in healthcare. During slavery, enslaved people were often viewed as property rather than individuals, and their pain and suffering were frequently minimized or ignored. Justification of medical experimentation. The false belief in Black people's higher pain tolerance was sometimes used to justify unethical medical experimentation, such as performing surgeries without anesthesia on enslaved Black women, as was the case with J. Marion Sims, often called the father of modern gynecology. Undertreatment of pain. Even today, this harmful misconception can lead to Black patients' pain being undertreated or dismissed by healthcare providers. Studies have shown that Black patients are less likely to be prescribed pain medication and often receive lower doses compared to their white counterparts. Mistrust of the medical system. The legacy of medical racism and exploitation contributes to a well-founded mistrust of the healthcare system among some Black communities. This mistrust can negatively impact health-seeking behaviors and adherence to medical advice.
Do you agree with me that the United States should join every other major country on earth and guarantee health care to all people as a human right? Yes? No?
Senator, I can't give you a yes or no answer to that question.
Health care a human right? Is health care a human right?
In the way that free speech is a human right,
yeah.
I would say it's different because with free speech doesn't cost anybody anything, but in healthcare, if you smoke cigarettes for 20 years and you get cancer, you are now taking from the pool.
Mr. Kennedy, do you know how many babies born in this country are covered through Medicaid?
I would guess, I don't know the answer, I would guess about 30 million.
I have it, Mr. Kennedy. About 41% or 1.4 million babies births are financed by Medicaid, according to the National Center for Health Statistics.
Right now, there's a 40-year-old law that requires hospital ERs accepting payment from Medicare to actually provide emergency care to patients. So let's say a woman experiencing a life-threatening condition like a heart attack goes to the ER. As a lawyer, you would agree that that federal law protects her right to emergency care, correct?
Yes. So
now a pregnant woman with life-threatening bleeding from an incomplete miscarriage goes to the ER. Let me rephrase that so you can hear. A pregnant woman with a life-threatening bleeding from an incomplete miscarriage goes to the ER, and her doctor also determines that she needs an emergency abortion. But she's in a state where abortion is banned. You would agree also as an attorney that federal law protects her right to that emergency care, correct?
I don't know. I mean, the answer to that is I don't know. If the state
Does it,
bans
well, let me ask you this as an attorney, doesn't federal law preempt state law?
The federal Constitution does. Sometimes not every federal law preempts state laws. It could be unconstitutional. Now, I'm
Well, I
not
would
trying to
tell
be
you in this
evasive,
case, let me ask you
Senator. I'm
this.
just telling you I don't know the
I
answer
appreciate
to
that.
question.
But what authority do you have over this as the director of HHS?
What authority do I have?
Yeah, to enforce the law,
In what regards?
to make sure that a hospital that receives payment from Medicare is ensuring that they are providing the necessary emergency care to patients when they present. It's actually the EMTALA law. So what authority as HHS director do you have with respect to EMTALA?
My understanding is that I have budgetary power and that it's pretty much limited to that. But if you tell me I have another authority, I don't even think that
Well, let me tell you,
we
you
have
do.
a law enforcement branch at HHS.
Actually, you do, and that's CMS. CMS actually investigates complaints of EMTALA violations, as well as the Health and Human Services Inspector General, who, by the way, was just recently fired by Donald Trump.